Alopecia, or hair loss, is incredibly common and causes significant distress to many patients. There are two FDA-approved therapies, topical minoxidil and oral finasteride. I'm going to talk to you about oral minoxidil for the treatment of male and female pattern hair loss. Hi, Dr. Knapp again, here to bring you medical information so you can take control of your health and make the most out of your doctor visits. If you have any questions or any topics you want to see discussed on this channel, feel free to leave a comment. First, a little bit of history. Minoxidil is actually an old blood pressure medication that works by dilating blood vessels. It was found that in patients taking minoxidil, there was a reversal of hair loss. This led to the creation of a topical minoxidil named Rogaine back in the 1980s. Since then, it has been the workhorse for treatment for androgenetic alopecia. There is a similar route of approval for 1 mg finasteride from the fact that patients taking 5 mg finasteride for an enlarged prostate were found to have increased hair growth. Topical minoxidil is typically applied twice a day, and this can lead to some compliance issues. It can also lead to scalp itching and an irritant contact dermatitis because of the propylene glycol content. Finasteride has anti-androgen properties, so it can cause sexual dysfunction as well as birth defects. Any hair growth that is seen on these treatments is lost if the medications are stopped. Now, the treatment of male and female pattern hair loss with oral minoxidil is not new. It has actually been used by dermatologists for decades. This is an off-label use, meaning it's not approved by the FDA for this purpose. Oral minoxidil has reasonable clinical evidence for effectiveness for hair loss. There are some side effects that you should be aware of, though. One, it can lead to an increase in total body hair. This is usually amenable to laser hair removal or topical hair removal if it becomes significant. It is a blood pressure medicine, so it can lower your blood pressure a little bit, and it can also increase your heart rate by a small amount. This is not typically seen because the dosages used for hair loss are relatively low. Because it dilates blood vessels, it can lead to swelling in your feet and your ankles. It can also lead to fluid buildup around your heart, but this is very rare. In trials, this medication is very well tolerated, and discontinuation because of side effects is incredibly rare. Cost is also a consideration, as these medications are not typically covered by insurance. The cost of topical minoxidil is about $8 for the serum and $13 for the foam. I looked on GoodRx for finasteride, and it's about $23 a month. Oral minoxidil, 2.5 milligrams, costs about $10.81 a month. If my patients are serious about combating hair loss, I typically take a multimodal approach to treatment. First, I make sure that nutrition is optimized. For my male patients, I usually start them on finasteride and oral minoxidil. For my female patients, I usually just start them on low-dose oral minoxidil. I usually recommend a 6-month trial to ensure effectiveness. So if hair loss is a problem for you, I recommend that you talk to your doctor about starting oral minoxidil, see if it's right for you. I hope you found this information useful. As always, take care of yourself and make the most out of every day.